Hi, I'm Dan from Correct Osteo Clinic, and today I wanted to talk to you about blood pressure and why we as osteopaths find it so important to take your blood pressure when you're coming in for your consultation and we're screening your medical health history. So I wanted to talk to you a little bit about the heart first anyway, so you get more of an idea as to why it's so important to us. So you might know already that your heart is a really important organ. It has to pump a lot of blood around your system all day, every day. So it's got one job to do and it does it really, really well. It's a well-designed organ. But it has no care in the world for your love life. As many people say, I love you with all my heart, it doesn't have anything to do with your heart love. Okay, it might raise it slightly when you're seeing someone who's quite attractive and so on, you're attracted to, but other than that, your heart doesn't care about your love life, unfortunately. It beats probably more than once every second. It does that 100,000 times a day, and it dispenses 6,240 litres of blood in a day, and beats about 3.5 billion times in a lifetime. That's quite a lot. So like I said earlier, it does it really, really well. We measure your blood pressure. So when you come in, we hook you up to a little machine. It normally goes quite tight around your arm and gives off a bit of a humming noise, really. The general reading for blood pressure is about 120/80. Okay, so systolic pressure is the top number. So generally healthy blood pressure is around 120/80. So that top number, that 120, is the systolic pressure. The bottom number is the diastolic pressure. So what does that mean then, really? So systolic pressure is the pressure or the highest pressure that your blood vessels experience as your heart is contracted. So as it contracts, it pushes blood into the blood vessels. That has to travel all the way to your feet and back up again. So it also has to fight gravity as well. Blood pressure does change throughout the body. So say my blood pressure would be different from my ankles to my shoulder, because gravitational pull is harder. Okay, so diastolic pressure is the bottom number. So like I said, the 120, the top one, the systolic, and over about 80 generally is the diastolic. So the bottom one, that is the least amount of pressure that your blood vessels experience as the blood's going round. So diastolic is when the heart starts to relax and blood starts to flow back into the heart. Okay, so the heart is really important, as you probably know already as well, that you can have, so you've got some complications to the heart. There's many conditions of the heart, but there is other ones as well that we sort of look out for immediately. So things like a heart attack, angina, even things like where your heart stops and it's called cardiac arrest. Obviously you wouldn't be sitting in an osteopathic clinic with cardiac arrest, that's for sure. However, people experience things like a heart attack in different ways. So females can experience a heart attack with just abdominal pain and nausea as well. So it's misdiagnosed sometimes for indigestion, whereas males would normally get left-sided things like shoulder pain, left arm pain as well, even left neck and jaw pain. They can feel quite anxious, and again you can still feel nausea, but you can experience things like sweating quite a lot as well. But like I said, females experience it slightly different. So they'll, like I said, get things like a bit of nausea and some abdominal pain as well. Okay, about 28,000 women suffer from a heart attack each year in the UK alone, and that's that's fatal really. So that's 2 times more than breast cancer alone. So that's 28,000 women suffering fatal heart attacks. Then that's 2 times the amount of the ones that will actually suffer from things like breast cancer. So it is really important. It's such an important thing to check for blood pressure. So like I said anyway, is that you can get these different referrals around the body from your cardiac system. So the heart can actually refer to pain in the left shoulder, can refer to pain down the left arm. Obviously you can get like chest tightness as well. You can feel like out of breath, quite anxious, nauseous. In women you can get that sort of indigestion feeling, that pain around the abdomen as well, left jaw and neck pain. So these are things that you can look out for as well, that can really save you in like critical instances. It's all about looking out for those signs. You don't want to have really high blood pressure. It increases the risk of things like stroke and things like heart attack, angina, the things that we spoke about earlier. So to reduce things like if you have got high blood pressure, so the American Heart Association decided in 2017 that actually high blood pressure is classed as 130 over 80. Now that put millions and millions of people into the category of high blood pressure. So I think it's a huge billions and billions of pounds of payout through things like the NHS and healthcare services, just for medication and so to treat high blood pressure and cardiovascular disease alone. So it is so important to try and lower your blood pressure. So things like exercise is a massive thing to try and reduce your blood pressure. Loss weight as well, so if you can try and lose weight. Reduce your salt intake as well, that's a big thing. And try and de-stress as well. Stressing can raise heart rate, and then obviously that will then lead to blood pressure increase as well. Things like alcohol can raise it as well. Obviously smoking, if you're building up things in your arteries such as plaque, cholesterol, that can obviously raise blood pressure as well. So things like if you're obviously in your arteries, if it's blocking the flow, your heart will actually pump harder. Alright, so a lot of even young, fit and healthy people now are suffering from heart problems due to ventricular enlargement as well. So you've got the 4 sort of chambers of your heart. The top 2 are atrium and the bottom 2 are your ventricles. Your ventricles are what does the work, the hard work, and it pushes the blood around the system. But they can become oversized as well, and that can then lead to things like sudden heart failure and so on. And this is what a lot of even healthy people are suffering from now, ones that you'd think that are actually quite fit as well. But so they are some tips to try and reduce your blood pressure. If you're worried, obviously, with your blood pressure, you can always come in, have a consultation. We can take your blood pressure. We can talk about sort of, your medical history and so on like that, and give you even some tips and advice on how to better those as well if needed. So yeah, I think that's quite a bit about the heart and why we take blood pressure and why it's so important. If you've got any further questions, please feel free to email me, give me a call, or come in, even if you want to chat for a consultation. Visit our website, www.correctosteoclinic.co.uk, and I look forward to seeing you in the future. Cheers.